Great morning and welcome to Plan Well to Live Well. I'm Jackie.
I'm Ethan.
And on today's show, the Plan Well segment of today's show, we have Miss Janice Pompey from the Dedicated Senior Medical Center. It's important that we highlight this woman who's impacting our senior population because March is Women's Empowerment Month. And what greater way to celebrate someone who's impacting the community like Miss Janice. So, Miss Janice, welcome to the show.
Good morning, Ethan and Jackie. How are you?
We're doing great. Thank you for joining us today. And we're going to have lots to talk about yourself and your center and the outreach you're doing to the community. So we're going to show our guests a little bit about our segment. And the segment is our Plan Well segment with Janice Pompey. Thank you, Janice, for joining us. And we look forward to having a discussion with you today about the community outreach for Dedicated Senior Medical.
Thank you. Thank you for having me.
Yes, and Jackie did mention today is also March 8th, is International Women's Day. So it's nice to have a woman on the show to celebrate the International Women's Day with you. So thank you so much. All right, Jackie. So,
you know what, Ms. Janice, if you would tell our viewing audience just a little bit about you and what you do at Dedicated, and share with us, if they're not familiar with Dedicated, they're going to be familiar today.
Yes. And what a great opportunity on a day such like to celebrate women. Dedicated Senior Medical Center, it celebrates women. As a matter of fact, we are a primary care doctor's office located throughout the United States. We have well over 100 centers throughout the United States. In Philadelphia alone, we have 5 centers. I am the cultural and community specialist, which is just a fancy way of saying that I am the person responsible for spreading the love and building relationships about the services that we offer throughout the Philadelphia region. Dedicated Senior Medical Center is a doctor's office that provide medical care to people 55 and older. Its unique model it's what really makes us stand out among many of the other doctor's offices, because we cater primarily to seniors. And people think seniors are 65 and older, but we start with what I call seasoned citizens, and that's the tender age of 55 plus. So the doctor's office has the unique model of going out into the community and providing resources to seniors that's needed. For example, some of the challenges that seniors face as it relates to transportation, having to go to different facilities to get testing done, having to have someone remind them of their appointments. We at Dedicated Senior Medical Center, we make it very easy and affordable for our patients to come to our centers by providing what we call VIP care. And VIP care just simply means we will pick you up and provide door-to-door service to bring you to and from your doctor's office. And we also make sure that we monitor the transportation, because we're living in some challenging times, and we take great pride in, if you have a loved one that doesn't live with you, they can assure that we will make sure that you get to the doctor's office safely. We also provide resources for our seniors. We not only focus on the physical, we focus on the mind, body, and spirit. And that's where my role comes in, by linking with people such as yourself and getting resources and information that would help meet the needs of their not only financial, but just their healthcare, socialization, housing, and things of that nature.
And that's wonderful. That's one of the things that both Ethan and I, we work with the senior population, and we help folks transition onto Medicare. Mm-hmm. And oftentimes when we sit with potential clients, and they're telling us of their situation of how oftentimes they may go to a primary doctor and they may not be happy with their services because they don't have a direct link, or they're seeing a nurse practitioner. So one of the business models that resonated with me with Dedicated was that my client has a direct line to their primary care specialist. Everything is under one roof. So that's one of the key things as we listen to folks and they share with us the difference between a group healthcare plan versus Medicare. And then when I'm sitting with folks and I'm able to share with them, hey, I'm excited. I have something new to share with you about how to visit your primary care. You may want to consider this as an option.
Yes, and thank you for pointing that out. It's very interesting. My parents are at an age that they need a little bit more support in regards to helping to choose the right doctor and making sure that their information is up to date and making sure that they're clear about the information that they're given. We at Dedicated Senior Medical Center, we have the unique model of making sure that we pull that patient in the office and provide them with services such as helping them with their health insurance. If they have questions about how to choose the right health insurance, we provide brokers to give them information without worrying about haggling or the whole predatory issues going out here and getting them involved in something that they're uncertain of. We also provide information in regards to if they need resources regarding housing. We bring resources into our center, and we have a room for them to provide that level of resource. And on a private level, we bring that to the office. We try to have things at our offices to make sure we make it a convenient and as a clear understanding for our seniors, and making sure that they leave with having all of the things they need to be a holistic person, in addition to adequate medical care.
Yeah. And I'll just compound on that. I had the opportunity I was called in to the office as a broker, and
Mhm.
it was nice sitting across from someone because it gave them the reassurance that I was a trusted advisor,
Yes.
and I was pre-vetted. So that level of reassurance that was to the client that was sitting before me, it just all of the typical barriers or walls, if you will, that people put up and not sharing their information and how they could be more transparent with me. It just made things so much easier and smoother as it relates to getting them the right type of insurance that they need, or just even just giving. I was an advisor that day. I was truly an advisor. I was just advising at that point. So I thank Dedicated for providing that for me as a broker, that I was able to truly give advice to a potential client. So
Right,
yeah,
right. We're dealing with a vulnerable population, and to to embellish on what you've talked about, just being in person. We during COVID, we never closed. When you call and contact our office, you will reach a live person. You don't worry about an answering service. You're going to talk to someone, and if there's an emergency, they're going to say, Mr. or Mrs. X, please come in if there's an emergency. We contact you on a monthly basis. Make sure that you talk to a doctor or see a doctor on a monthly basis so we can get to know who you are intimately and personally as it relates to your medical care. By building that relationship, we also learn about the things that's going on within your home that may have an impact on your health. So we make sure that we also connect with resources, and we're very picky about who we allow in our centers and who we allow to talk to our seniors, because we know that this is a vulnerable population. So by bringing those resources in person and having you talk to them in person, it makes a huge difference of making our seniors feel comfortable and not having to go out and vet people themselves. We build relationships, strong relationships with community people, brokers such as yourself, and other community resources to make sure that we can ensure our seniors we're giving them the best service that we can.
If I say a couple of things, and my parents are in their. My dad's going to be 80 in
Mhm.
in a couple of weeks, and my parents are seniors, older seniors.
Mhm.
And when you mentioned COVID and transportation, because Jack and I do service the senior population, and I agree with you, it's 55 or 50 and older.
Mhm. Mhm.
It's not just 65 and 70, but when we service this population, I do see that accessibility to medical providers, even though we have tons and tons and tons, but to make an appointment, to get an appointment, even for us, we're not quite, the senior
Mhm.
population, but still, even for us and my parents, it would seem that, to go see your doctor, sometimes it's 3, 4 weeks. You told us earlier when we were offline that this is a family business. Can you tell
Yes.
us a little bit about, how the family business treats the members, like family? I hope so.
Yes. Well, so that's one of the, in my opinion, that's one of the special things about being an employee for Dedicated Senior Medical Center, because the owners can relate to the need to provide quality care because of their experience with their own father. The owner's father is a doctor, developed cancer, and when he had gone to seek treatment, the care that he was given, the lack of empathy, and the unprofessionalism, just trying to research resources, especially at a delicate time like that when you get such a diagnosis there. And hence, they've opened up centers originated in Florida, very successful in Florida, and decided to expand the centers throughout the United States. One unique thing that we do that the patients don't see is every morning, each of our centers, we have what's called we touch down, we do like a check-in, and we make sure that every morning we talk about one of our core values, and that we all get aligned and centered, and we discuss how we're going to approach that day to make sure we provide key and professional services to our center. So we start our day off discussing our core values, just about 15 minutes. Every center is very consistent. And I'm impressed with that because it keeps the staff focused on the services we need to provide and why we're here to provide the services.
It's interesting you say that. I was just talking to my wife, and her parents are a little bit older than my parents, and her dad is, going through some treatments, and she says, just recently goes, "Wow, the staff at this office is so awesome." And I said, and then we talked about some staff members in another office that were not so awesome, and I said,
Mhm.
it's probably the training. If the staff is pleasant and helpful, it has to come from the top.
Yes.
And the top makes sure that the staff is pleasant, because I think, the type of work that Jack and I do and the type of work that you do, and I hopefully hope that the type of work that the doctors do is that they do have empathy,
Yes.
because,
Yes.
you probably see a lot, because you help facilitate the patients, the members coming in, so you see patients that are walking on their own, and then you see patients that need help. And so Jackie and I see a lot, and if we did not have empathy in the type of work that we did, it would be pretty be cold day every day if we just did this as a like robots, because you really have to have empathy if you want to have your customers, your patients enjoy coming to your center or enjoy talking to you. But I do recognize that some facilities just don't have that, and we've seen it. And it sounds like Dedicated dedicated has the patient center in mind.
Yes, it's very patient center driven. We it's interesting because our core values are based on love, accountability, and passion. And people would think it was corny when we would say no. Every morning we talk about one of our core values, and we engage a staff member or two, and make sure that they point out which value are they going to focus on today, to make sure that love, accountability, and passion is really shown and perpetuated in the center. And by doing that on a consistent basis, I mean, of course, we don't live in a perfect world, but by certainly doing that, and the standards of the owners, they make sure that each center director do this in their centers. It makes a big difference. I've worked in many places. I'm approaching that seasoned senior, um, so I've been around, and I am very impressed as a human being to see just how we manage and work with our seniors, and actually provide a labor of love to our seniors. In addition to us, the doctors, seeing this patients on a monthly basis, we have what's called love calls. We check on our seniors in the community. Yeah. So my father is currently a part of that, and he was very surprised to see that he received a call, and he told me he was shocked, and he said, I got a call and I thought they were reminding me about my appointment because I know when my appointment is. He said, but they were just calling to see how I was doing, and to make sure that everything was okay, and to see if there's anything I needed. That makes a huge difference. Healthcare is very aggressive, very busy, and everyone has their day-to-day due diligence, and we leave out those soft skills that are very important, especially at this age. We're so busy, I forget about certain things. So to have someone call me and remind me, or just check on me, and it's not just about an appointment reminder, it's like checking to see if I'm doing okay. That makes a difference to show that you care. So that's another thing that I find it's very impressive and impactful, and it gains trust with our patients. We also provide a safe space for them. We not only have space for them to come see the doctors, we have a community space. We provide activities. So for social engagement, we have a safe haven at every center. If they wanted to come and play bingo, if they wanted to learn information, if we have line dancing, we try to make it creative. We actually promote healthcare in a fun manner. So I like that aspect of it as well. Sometimes we have Bible studies. We let the ladies use the rooms, or lady and gentlemen use the room to have Bible studies. And I just think that it's such a creative and innovative approach to making sure we bring seniors in a safe and loving environment.
Yeah, I was gonna say, it sounds like to me, I mean, I've never visited your facility. I know Jackie has, but it sounds like to me that besides being a medical center, you're like you provide a social, senior, and medical type of atmosphere, so that, let's say, a patient of yours or a customer of yours could come for, say, a medical appointment,
Mhm.
but then maybe also participate in a Bible study or another social or community event at your center. Am I right?
You're absolutely right.
That's interesting.
Yeah, we in addition to like that medical service, and this is the owners are very big on this. They're very big on making sure that we have a space that if the seniors were not ready to go home or just needed a small outing, we have a separate space that doesn't interfere with their medical care at all. Because the centers are designed in such a way, very beautiful centers, always kept clean, and we have a room, a space, an activity room that if they wanted to come, and it's happened many times, seniors will come to their appointment, and We have you don't wait more than 20 minutes. So we're really big on time management. And you spend more time with the doctors than you do in the lobby. So when they come out after their appointment is completed, they'll they'll see activities going on in the activity room, and they'll ask, "Hey, what's going on?" And they'll see our calendar, activity calendar that's posted at the front desk a lot, and they'll ask if they could be a part of it, and we're like, yes, please engage, and we'll send transportation, when you're done. So very engaging, very engaging.
Janice, to that point, and just elaborate on the cultural. We're cultural. We're community. We want to be involved, and that's one of the other areas that impressed me the most with how you engage everyone. So
Mm-hmm.
I think about if from the social aspect of it, and if someone doesn't have a loved one at home, or they want to feel connected to someone, and it's almost like you not look forward to going to the doctor's office, but look forward to going to dedicated, so you have that sense of community, that sense of belonging. um, the day that I was there, there was a painting with a twist going on, there was some
Yes,
bingo happening,
yes,
someone won some prizes.
yes,
It was just like the person, they just hit the lottery tenfold, in terms of they were there for an appointment, and they did their grocery shopping. I mean, this lady the she took full advantage of your center being in that shopping center, and the amenities that the shopping center offered. Then she was over here, and I was exhausted just
watching all the interactions,
the
right?
interaction, the excitement. And I
Yes,
was like, wow, this is the place to be
yes, yes.
in terms of your holistic, just a whole approach. So just imagining, just uh, dedicated, or you in the staff there, how you're impacting someone and just making their whole day, that whole experience was just so positive. I mean, the glow, the smile, the
Yes,
everything about this woman's appearance, and everyone else that was there, their appearance, even the men. They were like,
yes,
yeah, oh, this is great.
yes, yes. And it's optional. It's when they come into the center, it's interesting because you get to know them on an intimate level, but just having a place to come where you can say good morning. Some of them, you don't know what their diagnosis or what they're going through medically, but when they come in and they're able to smile and laugh and just engage in different things, they forget about some of their challenges they're going through medically. So it makes a big difference, and to have that social engagement without feeling like you're obligated to be there, and they're there because they want to be there, just to do something positive and fun as a part of their day, that makes a big difference. And we're very proud that we can provide that level of entertainment or level of community engagement. And it's a full gamut. Like bingo is serious. You just don't mess with bingo. Painting with the twist, they love that. And then we have our informational sessions. Our doctors are extremely busy, but we have doctors that our doctors, some of them, they're assigned to going out, they're cultural ambassadors, so they go out and they do doc talks. We have them scheduled, they go to the churches and they speak to groups about just any health topic that either the church or the community chooses, or just something that's really important that our patients need to know. So we're not only do it in the center, we go out on the road as well. And I'm constantly busy because we're going to senior centers, community centers, churches, and we engage in food distributions. We link with other home care agents, like home care agencies, and different insurance companies. Since we take them all, we get like a lot of support from a lot of different people, so we don't even carry the load because they see what we're doing in the community, and everybody's like, listen, can we be a part of that? So it brings the community together. So the title cultural and community specialist is just so befitting because of the fact that we really bring a community together to bridge the gaps of the needs for our seniors. And I think that's one of the proudest things I am with being a member or a staff member of a dedicated senior medical center.
Janice, we're going to be wrapping up soon, but I have two more questions for
Sure.
you that I want to get in. You know, statistically, back, 60, 70 years ago, life expectancy was much less than it is today.
Hmm.
It would appear to me that your centers have recognized that the seniors have active lives. They're not just the senior that retired, rocked on their chair, and passed away 3 years later. This is a senior that's retired or that has an additional 20, 30 years of full life ahead of them. And would appear to me that your center had recognizes that. So if I can kind of ask you, I don't know, if you can tell or not tell, because you did say something like, hey, when they come in, we don't know what kind of diagnoses they have, but we want to give them a smile. But I
Hmm.
would say that if you had an idea, how many of your customer seniors do you see as being, I'm not saying sick or just active, whether they're sick or not sick, but active within their lives?
So interesting enough, that's a great question. So Ethan, within the senior community, right? People don't realize that there's cultures within the senior community. So there's the young senior, there's the senior that has a lot of comorbidities that, we're just helping to manage their care. And then there's seniors that are just newly retired and um, feel like they don't need to come in and do an assessment. When you come to our center, it's not just a matter of those that are morbidly sick and have dire prognosis. We add on by bringing them into our center and getting ahead of their care, being proactive. We can extend their care to their life expectancy about 5 to 10 years added on to their life if you get ahead of your healthcare, and that makes a big difference. What we focus on, more importantly, is the fact that the new model now is making sure that seniors are aging in place at home. Its stats shows, and I don't want to give false stats, but stats, we have stats, our doctors study this. It shows that when a person is at home and receiving care, it's quality care and they thrive in a community that they're familiar with. So we provide those resources for them so that they could be comfortable in their own space. So having a model like dedicated senior medical center and providing the level of care, making sure we understand and know what their baseline is, because your blood pressure, Ethan, is different from Jackie's blood pressure, right? Her baseline is different than yours, which is different from mine. So the model that we have, if you come into our center, we'll know what your blood levels, like what's common, what's your baseline versus if you go to an emergency room every time you're getting a different doctor trying to figure out and guess what's going on. Or if you go to another doctor's office, they don't really get to know you intimately and know who you are. You come to dedicated senior medical center, you have your doctor, the doctor talks to you on a monthly basis. They know what your levels are, they know your blood work, they know what your pressure is, they have that common baseline and they can get to know your health intimately. So with my father, when his blood pressure is slightly off, if the hospital calls him or something, they'll say, no, we see in his charts on a monthly basis, this is what his baseline is. And it helps with medication management. That's another thing. We will manage your medications for you. A lot of times you're on different meds, you go to different specialists, you come to the center, our doctors will help manage your medication. We have home care nurses that go out, help manage your medications and make sure that you're taking the right dosage, the right regimen. So it's a lot. We really provide a level of care that will extend your quality of life.
Can you give me that breakdown of those, what do you call it, the young seniors, the healthy seniors? How did you break that down?
Yeah, so you have the seniors that are newly turning, 55 and older. So you have the young seniors, right?
Young.
They typically are ones that say, listen, I've worked, I'm okay, I'm healthy, and think that they don't need to come to the doctor's office as much. You have another set of seniors.
That's the young seniors. Okay.
That's the young seniors. And trying to engage them into coming to the doctors sometimes can be challenging because they're like, there's nothing wrong with me. I don't need to see the doctor on a monthly basis or talk to a doctor on a monthly basis, but they don't realize that their health is failing and they're not on top of it as much as they think they are. So when we engage, it's interesting, we engage the young seniors by, using preventative measures, have them engage and be ambassadors, and engage in the activities. We sponsor different bus trips and things of that nature, and we give them information to make sure that they could stay on top of their health. Then we have the seniors that are kind of set in their ways, saw their doctors for 20 years, but really don't really know what's going on. So, we nurture that community by making sure that we have doc talks. We make sure that we provide that transportation, bring them in and let them get familiar with the doctor. So we manage every group a little differently. It's not really a one size fit all approach, but one consistent message that we give them is love. That's one consistent.
Thank you for that information, Janice. Thank you. Anything else that you would like to add on?
I would like to say thank you, Ethan and Jackie, for affording me an opportunity to be on your show, and would also like to invite anyone that's interested in taking a quick visit of our site or would like to receive sponsorship or support in any type of activities you're doing to work with seniors. Please give me a call at 267-615-7942. We welcome you, and I'm looking forward to hearing from you. Thank you.
Thank you, Janice. And hopefully you'll come back to our show again.
Anytime.
Thank you so much for being here today. Wow, what a great guest.
Amazing guest. We learned so much. And guess what? There's more to healthcare, more to seeing your primary care physician than just going to the doctor's office. There's community, there's so much more. So what an amazing guest. Janice Pompey is definitely in Dedicated Senior Medical Center is definitely making an impact in the community.
That's great. So our special guest next week is Jim Turner, owner of Interim Healthcare of Lower Bucks County. And it's interesting what she said about aging in place. So Jim Turner, his healthcare is all about aging in place and supporting the seniors to age in place. So Jim will be joining us on our show next week. So here's a little bit more information about Jim. All right, everybody. So thank you, everybody, for joining us today. As always, we want you to go to our YouTube channel, Plan Well to Live Well. Click on the calendar link in the description, book a free consultation with Jackie and myself to discuss insurance, retirement, real estate. Also, you can use that link to ask us to have special topics that are maybe interested to you, your family, your neighbors. That would be great. And also, if you want to be a featured guest, anybody's welcome to be a featured guest. We welcome that. We're taking on the bookings. So we have a few guests lined up, but we certainly would love to have more featured guests. If you want to be a sponsor or an advertiser of our show, also go to the YouTube channel, Plan Well to Live Well, and click on the calendar link to schedule an appointment. Please follow us, like us, and subscribe to our channel, Plan Well to Live Well.
As always, Ethan and I would like for you to, when you plan well, you live well. Take care. Great job.